Hi, this is Forrest Lightberg with the Santa Barbara Response Network. Welcome to this Compassion Center today about staying healthy and safe during COVID-19. We're with Dr. Michelle Hansen-Cárdenas, who is a naturopathic doctor offering broad spectrum care through a comprehensive intake process, individualized treatment, in-depth follow-up visits, and customized lifestyle regimens that result in the optimal health and well-being of her patients. Her specialties include postpartum care, endocrine disorders, including thyroid and adrenal conditions, acute and chronic infections, and gastrointestinal disorders. Results are achieved through clinical nutrition, hormone replacement therapy, nutritional supplements, and more. I want to welcome you here today. Thank you so much for joining us.
Hi, thank you for having me.
And as well, I want to introduce Gina here, who's a co-founder of the Santa Barbara Response Network. Gina, thank you so much for your time.
Thanks.
So let's dive in.
So I just wanted to.
Gina,
Go ahead, Forrest.
No.
I was going to say that my motivation for having Dr. Michelle Hansen-Cárdenas on was because I've been thinking about taking power during these times over our well-being. We've been talking a lot about mental health, and a huge part of our well-being is our physical health, our spiritual health, but that we have power over how healthy we are, the lifestyle that we choose to live. And I think in these times where there's so much fear and anxiety, and we have so much, anticipation of bad things, I know Michelle's approach is one that I think we can all take in to say there are things that can make us strong and stronger. So I really appreciate you being here today to share that with our viewers. So Thank you.
Thank you for having me.
Yeah.
Absolutely. So first off, I want to ask you what issues or concerns you're seeing in your naturopathic practice since the COVID outbreak.
One of the things that I'm seeing a lot of is anxiety, mostly pertaining to health. People don't often know how the degree to which they need to be concerned for themselves, for their family, in terms of COVID-19 exposure. And I also see, a lot of it's mental, emotional, and people feeling isolated, people feeling, like they're missing hugs and contact and being a part of their community. What I've been working with people on a lot is just how to navigate that, how to stay positive, and how to, manage stress in a way that's feasible during this time, because any kind of stress is, whether it's, inflammation in some part of the body, or it's, stress from being in the middle of a pandemic, all of that wreaks havoc on the rest of the body. So, that's been a big part of what I've been working with people on and seeing in my patient population.
Sure. Well, with that, what would you suggest as some of the practices and principles that people can implement into their lives?
Yeah.
Are very concerned about staying healthy and strong and resilient physically during this outbreak?
Sure. The things that I think are the most important are what I consider to be the pillars of health. So there are things that give us a foundation for health. And they're simple, basic things, but they're not always easy for people to stay on top of. And that is exercise, diet and nutrition, stress management, sleep. All of those things form the basis for our health, the foundation of our health. And if those things if the foundation is weak, then we are going to be more susceptible to a virus, and we are going to be more immunocompromised. As far as exercise goes, well, that's one of the things I'm hearing from a lot of people as well, is I can't go to the gym. My whole exercise, practice has been disrupted. And so I've become more sedentary and I'm not being as active. And of course that comes with negative self-talk and stuff like that as well, and just not feeling as good physically. So, how can we still do those things that give us that foundation of health during this time where some of those things might be interrupted? So coming up with strategies around maintaining those pillars for health. You're stressed out, you're not sleeping, that's gonna unsteady your foundation. So those are, I think, the things that are the most important, and then of course there are other things on top of that.
So what are some specific ways to combat stress and induce a more restful sleep that you would recommend for people?
So that's a great question. As far as stress management, in some ways, I think it's very individual. One of my questions for patients, always in my initial intake with them, but it comes up periodically after that as well, is what do you do to manage stress? Because what you do to manage stress might be different from what I do to manage stress. And how can you continue to do thing, maybe it's a spin class, that's like your stress management. Well, you can't go to spin class, you don't have an exercise bike at your house. How can you continue to do that while you're on lockdown? So, exercise can be a huge one. One thing that I've been encouraging in people a lot is just getting outside, getting into nature. There's actually a lot of really wonderful research on, both connecting bare skin to earth on a regular basis and how that can, give you a healthy supply of positive ions that kind of equilibrate your electromagnetic field to that of the earth, and that shows to have a lot of health benefits. There's also just the idea of what in Japan they call it, I forget the Japanese word, but it's called forest bathing, where it's basically just time that you go out and you spend time among trees. And there's actually a lot of research that's been done on these things to show the huge benefit that they have to health. And that's one of the things, at least here, we can still do that. We can still get out into nature. It's something that we can do and maintain social distance from others. And we can do it very safely. So getting outside is huge, I think, for physical health and mental, emotional health. Other things, mindfulness, meditation, mindfulness, not meditation. There's a lot of ways that you can practice mindfulness that don't require you to sit and be still. Home yoga, take a bath, put some magnesium salt in there. Magnesium is very, very supportive for the parasympathetic nervous system, which ramps your stress response down. So there are a lot of tools that we can be using during this time to manage stress, and even just self-care. Self-care is huge. And what does that look like for you? What is self-care for you? What is self-care for you? And that's, again, going to be individualized.
Gina, did you have anything you wanted to
Yeah, I wanted to ask Michelle. So it's everything she's saying is so important, and I try to do that myself. And I'm thinking about diet and supplements, whether people, I don't know how easy it is to get fresh things. Of course, we want to get everything we can through our diet, but in terms of stress and well-being, are there, I know everybody's individual and you can't recommend overall things, but is there something on that level that people can be aware of, Michelle, to keep themselves strong and healthy?
As far as supplements, you mean?
Yeah. Hmm. And diet to be
Yeah, I
aware of.
mean, sure. I mean, diet, I think, one of the big things is eat your vegetables. This is like the most cliche thing I could ever say, but eat your vegetables, eat an array of vegetables. During this pandemic, it's been so striking to me that you go into a store and the canned section is depleted, the frozen section is depleted, there's no ramen anywhere to be seen, yet there's so much produce, and like nobody seems to be really
Amazing.
diving into that as deeply. So that is the thing that's going to keep us nourished, and that is how, if you eat a diet that's rich in different colorful vegetables, all of the different colors have different things to offer us, and that is like the biggest thing that we can be doing right now. And I think it's, especially since people are trying not to go to the store as often, that can be a big thing that is falling off the health wagon for people right now. As far as supplements, I mean, that one's a little bit tricky. Some of the big ones I am using with people for just general support right now, I mean, vitamin D, absolutely. That also ties into getting outside, but a lot of people don't get enough. Even if they're outside on a regular basis, they are not getting enough vitamin D. Magnesium is a big one for stress, and a million other things. I mean, vitamin C, it's like tried and true. It gets depleted when we are sick, so we need a lot more of it when we are sick. Zinc also. Zinc helps your white blood cells do their job. And when you are sick, you burn through your zinc, so you need a lot more. And there are plenty of herbs as well. Again, all of these things, I would say not everyone necessarily should go out and start taking these things. If you have high levels of vitamin D, then you're doing great and you don't need to supplement it. So I would say work with your health practitioner on those things. If it's a health practitioner that is knowledgeable about those things. If not, come and see me. I can talk you through it.
How about a basic multivitamin that provides a lot of these vitamins and minerals that you're referring to? Would you have a particular brand that you would recommend that people look into for a multivitamin, multi-mineral supplement?
Yeah, that's a little tricky of a question, in that, I mean, generally, if we are all eating a high vegetable diet full of organic, pasture raised meats, good eggs, all of, wild caught fish, I don't think we need to take a I don't recommend a multivitamin for very many of my patients. We should be able to get those nutrients from our diet. That doesn't mean that that always happens, especially with people who have chronic gastrointestinal disorders and they're not absorbing the nutrients from their diets. They're going to need other things, but often I do those things in a more targeted way. Like, oh, you're low on vitamin B12, let's give you vitamin B12. A multivitamin gives you a little bit of a lot of things, whereas a targeted vitamin is going to give you a higher dose of this one thing that you really need. So a little bit of a lot of things, you can get that from food, and you should get that from food whenever possible. In terms of brands for multivitamins, I do like, there's one from Pure Encapsulations that I like. I like Thorne Research. Generally, these are supplements companies that only sell to doctors, so you can't just find them at a health food store. But there are really important aspects of a multivitamin, such as activated B vitamins. If you're seeing just folic acid in your multi or your B complex, that's not an active form of that B vitamin. And a lot of people don't do a very good job of turning their folic acid into folate, which is the one that's actually needed. So I recommend, a methylfolate so that's like one example of something to look for. But there are a lot of other things as well that that kind of factor into that as well. So it's, you know,
And
yes. And so for some people, multivitamins are good, but generally I don't use them a whole lot.
and how about sunlight, vitamin D? Now, if you're out in the sun and you have a decent amount of skin exposed to the sun in moderation, I mean, how much vitamin D can you produce from that? Mhm.
So that's a very it's variable, basically. There's a big difference in the amount of vitamin D that one person makes versus another. There's a difference in the amount of vitamin D receptors that we all have in our body. And, you know, with vitamin D isn't really a vitamin. Vitamins we have to get in our diet. We don't get vitamin D from our diet generally. We make it in our body. So it's actually more similar to a hormone than it is a vitamin. And the reason I say that is because it's not just that you need to get these building blocks in your diet. Outside exposure really helps. But I mean, a lot of people just need to take vitamin D because they aren't making enough. I've had a patient that, you know, was very deficient in vitamin D when we tested him, and he said, well, I live on a boat. Like, I'm outside all the time. Like, how I'm getting plenty of sun exposure, how am I still deficient? And that's just the reality for a lot of people. You know, there's you know, weather has to do with it in some ways, but even people down here in Santa Barbara are very, very, very frequently deficient on vitamin D. So,
do you have an amount that you would recommend taking of vitamin D?
I mean, it depends on what your level is, and I test all of my patients to see what their level is. In my opinion, the target that you want to look for on lab work, you want to be in the 60 to 80 range
Right.
for kind of the average person. A conventional lab and a conventional doctor will tell you if you're 30 or above, you're fine. But for proper immune function, we really need you more in the 60 to 80 range. And this is kind of an area where I differ from, you know, where naturopathic doctors in general tend to differ from conventional doctors in that, okay, there's a range where you're deficient and where you're not, where you have a condition where you don't. Well, what about where are you optimal? You know, we don't just want to not be sick. We want to be well. And so with vitamin D is a perfect example of that. And, you know, for cancer patients, I recommend being in the 80 to 100 range on the lab. So it really depends. And honestly, there's a big difference in how quickly people accumulate. I've had somebody, let's say they were 20 on the lab, and they went up to a 50 in 2 months of being on 5,000 international units. I had another person of that same, and they went up, you know, to 22 during that same amount of time. So some people can accumulate it a lot faster in the body than others. There's also different forms of vitamin D, capsule forms, there's liquid forms, and I tend to find that the liquid forms do a better job of increasing people, like showing up on blood work as an improvement. But I have a lot of people that have come in to see me as new patients who say, oh, I've been on 10,000 international units for 3 years. Why am I deficient?
Now, even if one could get their vitamin D from a supplement, aren't there other benefits to actually getting sunlight and the full spectrum of the rays?
Yes.
And is it true that it's really not sun exposure technically that's problematic? It's sunburn?
Yes. So there's that's a long discussion.
Okay. Well,
So we don't quite have full time for it. But yes, you're absolutely right. And and I don't ever say, here, take this D, you don't need to go outside.
Right.
You know, getting that sun exposure and encouraging your body to make the vitamin D that it's meant to make is really important still. It's just for a lot of people not enough, so they need more. But even when it comes to grounding and force bathing and all of these other things in sunlight, there are a million other benefits that the sun has. And it depends on skin tone in terms of how much exposure that you can really tolerate. Some people can be out for 2 minutes and they are a lobster after that, and that's not good. That's a highly oxidative state for their skin. So, and some people can be out there for quite some time and not have that. So there's just varying degrees of the amount of sun exposure that people can tolerate. But spending time outside every day in the sun with bare skin, whether even if it's just 5 minutes a day, is hugely beneficial.
Sure. And bringing it back to sleep patterns. Yeah.
I was just going to ask something to piggyback on what you said, Michelle, about being a naturopathic physician, a doctor, and the differences. I see your practice is different than going to a conventional doctor, and some of the people listening may not know what the difference is, and I just thought it would be interesting to speak to that and what the focus is in your practice.
Yeah, absolutely. So one of the big differences, our first 2 years of training are virtually the same as a medical doctor program. We learn all of the same things. Where we differ is in our treatments and in our philosophy. So the philosophy of naturopathic medicine is that we want to improve the way the body is functioning, but we also want to honor that the body has an innate healing mechanism. And how can we support those mechanisms? Conventional medicine is often about, well, you have pain, so we're going to give anti-pain medications. You have reflux, so we're going to give acid blockers. It's opposite. It's allopathic medicine. And there's a place for that, absolutely. And we need that kind of medicine, absolutely. But when it comes to like general wellness, I think the naturopathic approach is a little bit better because we're really supporting the way the body is meant to function. When it comes to disease, one of the emphases of naturopathic medicine is to find and treat the root cause of disease. So, okay, yeah, you have reflux, you have acid, gastrointestinal reflux. Well, why do you have that? Not just here's an acid blocker. Why do you have that? And what can we do to restore that function so that you don't have reflux? Otherwise, you're going to be on this acid blocker for your entire life. And I have had many people come in saying, oh yeah, I've been on this for 20 years. Even if you read the label of those kinds of medications, they say like, don't take longer than 2 months, or they have certain time frames.
Right.
And so in that's a perfect example of not treating it from the root of the problem. If you treat it from the root of the problem and you're able to rebalance the patient in that way, then they're not tethered to these medications for the rest of their lives, and they can actually get better.
Would statins
so
be an example?
true.
Go ahead.
Would statins be an example?
Yes, statins would be an example in a sense. Cholesterol is kind of a bigger issue in that, people with high cholesterol, it's not always necessarily because of their diet. It can be just because their body makes more cholesterol than it should. But that said, a statin does do some harm, especially when it's taken for a long period of time. And there are other things that can lower blood cholesterol levels as well, that are not statins. So, in my opinion, try the natural stuff first. If you need the really big, strong medications, then you need those medications, and that might be the case. But most of the time I found that through diet and lifestyle and nutrients and supplements, we can stop people from going into that zone of needing things like statins.
I've heard a really fascinating way of putting this, and you can let me know if you agree or not, in that, well, a couple things. One, it seems that traditional allopathic medical approach is more like addressing disease and addressing disease, and a more naturopathic, holistic approach would be more creating health.
Yeah.
And maybe the emphasis and the focus is different.
Yeah, absolutely.
Yeah.
And so is an integrated medicine sort of an approach to combining both philosophies where appropriate.
Yeah.
Yeah.
Yeah, I think that's the most important thing. I mean, there's often this perceived like us against them. It's not them, you know. There's alternative healthcare practitioners and there's conventional, and like thank goodness there's both because they're both so important and they have different things to offer. But when you integrate and when I'm able to work together with a medical doctor that my patient is seeing, that's when we see the best outcomes. It should be a partnership and a team of people that can help any given patient.
And it is part of this
I
picture.
feel so much.
Gina,
I was just, I felt like in terms of psychology and trauma, what you're saying fits the model of often someone will be in distress emotionally, psychologically, and they'll go to a therapist. And if we don't look at the unresolved trauma and grief that might have been leading this person to build, you know, a series of responses and reactions to that, it's just going to keep going. And just giving, I know medication has its place, but so easily people just want to get out of the pain. So they want to take a pill or they want to sleep, but it's really our work, like your work, to find out, well, what happened to you? What's this pain? What, you know, it's a journey so that they can live a life that's, you know, free of these symptoms. So we have to take the time. It's a process, and we've got the quick fix mentality. And I think, and I like what you said, that everybody's individual. And I know you make very personal assessments of everybody that comes in so that you're responding to where their body is right now. One question I had is, how does your practice look right now with COVID? Because can you still do those assessments with people because you're doing telehealth? I'm just curious how you're able to manage that right now.
Yeah. Well, and to your point of needing to do the work and people wanting the quick fix, that is one of the big things. And the kind of medicine that I practice, you're not like going to start taking this and tomorrow morning you're going to wake up feeling better necessarily. It takes work. It takes diligence. It takes, you know, changing your diet, your lifestyle, and not everybody's willing to do that. But I find that when people do really take an empowered approach to their health, they feel better, they thrive. They don't just like, oh, it's not that I just don't have the joint pain anymore. I feel better than I felt in many years. And that's, you know, we have to be an active participant. I am not going to heal you. You have to do the healing. I can just guide you through the practice. Right. And, you know, in relation to my practice, it looks really different right now. Fortunately, there's still a lot that I can do. I'm not doing face-to-face time with my patients at this point. I'm not able to do physical exams, but I can still do most of what I generally do with patients, which is a really good thing. And, you know, it's definitely been slower than it normally is, partially because a lot of what we do is based on blood work and lab work, and people don't want to go to the lab to get their blood drawn right now. We do have residents at our clinic that are still doing blood draws, so that people aren't going to a lab where thousands of people have been. It's a lot, you know, less exposure, and we have really good practices around making sure that things are cleaned off in between patients and all of that. But still, there are some people that just don't want to leave their homes. They don't want to go anywhere. They don't want any of that. And so while that is a limitation, there's still a lot that we can do. And one thing I tell people, because I do a lot of work with hormones and thyroid and stuff like that, there's half the picture that is the labs, and there's half the picture that is how you feel. And I use both of those things probably equally to determine, you know, are you on the right dose? Are you on the right medication, whatnot? And I can still do that. remotely, you know, and I can still see half that picture at least, without having the blood work. And for some cases, I might say it's really important that you go in and get this blood work done. Let's figure out a way to do it. And then we do a lot of home testing too, like a stool analysis that's collected at home, or salivary panels. So we can still do a lot of that as well. And a lot of it's just pivoting, and, you know, we're figuring it out a little bit as we go along in terms of how can we get creative in a way to support these patients, even though they're not sitting in front of us in our office.
That's wonderful.
So,
You're still able to do that.
Mm-hmm.
And where can people learn more about your practice if they want to, you know, sign up for a consultation or meet you?
Absolutely. Well, I practice out of a clinic that's in downtown Santa Barbara called Pathways to Natural Health. We're on the corner of De La Vina and Anapamu. And my website is santabarbaranaturopath.com. So pretty easy to find me there. I'm also on Facebook, I'm on Twitter, and I'm doing a lot of posting there and health-related articles, and just trying to always keep people informed about ways that they can be improving their health through the COVID times, and also, you know, just in general. So I'm trying to be real active on that, especially right now during this time.
Sure, absolutely. Hey, I just want to ask you really quickly. We talked about diet before, but could you speak on the importance of cutting out refined, processed, manufactured foods? I mean, you talked about fresh, live, organic produce, fruits and vegetables, but can you also speak to what would ideally be eliminated from the diet? Because, well, we all know that that can be quite harmful.
Sure. I mean, one of the things that should certainly be eliminated is, I mean, anything that's artificial or heavily processed, artificial color, artificial flavor, anything with trans fats, anything with high fructose corn syrup. Even within the processed food worlds, you can find good products, you know, where they're organic, they're made with whole grains, they're still made in a processing facility, but they're better than, you know, these organic whole grain crackers are going to be better than the Ritz crackers that are covered with, you know, Roundup before they're harvested, and then they're made in a plant somewhere, and all these things. So there are better options even within processed food, because sometimes, you know, especially during this time, people aren't going to the store as often, and sometimes it's hard to be on 100% whole food diet. But as long as you are doing your best to eat whole foods 3 times a day, and, you know, I mean, people who can cook, especially, it's really a good time to flex that muscle.
There's just so much here I could ask you. We're coming to the end of our time.
Sure.
I just wanted to slip in before you were talking about sun exposure. And my understanding is that when you have a healthy sun exposure during the day, it triggers the production of serotonin in the brain, which then when you're trying to sleep better in your life, it's that when you have enough serotonin during the day, then your melatonin production at night is enhanced and more functions more efficiently, which causes you to be able to sleep better. Is that true, that getting enough sunlight during the day helps trigger the appropriate amount of melatonin to help people sleep better?
So yes, there are a lot of factors that go into melatonin production and sleep overall. Sunlight and activity levels are a couple of them. What your adrenal glands are doing throughout the day is also a big factor in terms of your stress hormones. If you have high stress hormones that are continuing into the night, you're not going to make enough melatonin. And then also one of the big things for sleep, and especially related to melatonin, is blue lights. Dim your blue lights after. I mean, I have mine synced with sunrise to sunset, you know. So once the sun goes down, all of my screens are filtering blue lights.
Right.
And, you know, phones, computers, they have a function to do this, you know, built in now. On an iPhone, it's in your, if you think you go to like your screen,
Yeah.
you know, and it's called night shift, and you
Yeah.
can set that. But that's a big one, because a lot of people are, you know, sitting in front of a TV, or they're home in front of their screen all day, working from home. They're watching TV at night, and that triggers your pineal gland. Your pineal gland's right here. When that triggers, it shuts down melatonin production, and it makes it really hard for people to sleep. So get rid of any blue lights in your house after sunlight.
Fascinating. My goodness, you know, I could talk to you for so long. We're coming to the end of our time frame here, but in you know, as we come to the conclusion, I just want to see if you and Gina have any final remarks that you'd like to make as we begin to close this out.
I just had one thought from what Michelle said in terms of what we do at the Santa Barbara Response Network, and why I like the concept, the philosophical concept of psychological first aid. The philosophy behind it is that we're not fixing the person when they're in the middle of a trauma response. We're helping them to, it's their own resilience that we're supporting. They're going to get through this. They're going to get better. They're going to find their equilibrium. Right now, they're off kilter. They've experienced something that's really impacted them on every level, and they're having this trauma response, but we believe that they will come back to that state of resilience. And I feel like that's what you're talking about, that you're trying to achieve with your patients, is optimum health, and that the body can heal itself. And in these times, those messages are so important, because they're just not in the media. They're not talked about. It's like, we're going to all die from this. You know, it's just this terror. When we have a strong, healthy body, we have to honor that. So that's my little soapbox.
I love it, Gina. That's absolutely true. That's absolutely true. And it's empowering to know that you can change your health for the better. You can, you know, and I would say my final, you know, my final statement, as official as that sounds, just other tools, you know, move your body every day, at least 20 minutes. There's actually research that has shown that getting exercise 7 days a week is different than 6 days a week as far as its impact on the immune system. That's kind of profound in a way, because you'd think I exercise 5 days a week, 6 days a week. There's actually better immune function in people who exercise 7 days a week. And it doesn't have to be CrossFit. It can be a 20-minute brisk walk. It can be floor exercises in your living room. So, you know, get outside every day, move your body every day, nourish your body every day. Go to the farmer's market. It's still open. Go to the fish market. They have fresh fish that's caught locally all the time. Go to your, you know, buy meat from your local farmers. Like, there are so many options right now. The fish market is even delivering. There are many services to get good, whole, organic foods into your home that don't even require you going to the store. So utilize those. Make sure you're getting at least 7 hours of good sleep every night. Take, you know, 10, 20, 100 deep conscious breaths every day as a way to just take down your nervous system and be present for a second. I mean, there are so many simple things like breathing that we can do that are going to make us more resilient, make us more clear-headed, give us more energy, you know, support our immune system, and just help us to thrive both mentally, emotionally, physically, spiritually during this time. So
I love that.
That's my soapbox.
Yeah.
And we live in Santa Barbara. I mean, you could take a walk barefoot on the earth in the sun with skin exposure, while brisk walking and getting your nature.
Yeah.
You could do many
Yeah.
things simultaneously, right?
Yes, multitasking.
Right.
So lovely. Anyways, you know, we've come to a little bit past our time frame, but there's so much here. So I want to thank you so much for joining us, Michelle.
Yeah.
Thank you so much for having me. It's been really fun.
And to our
It's
audience,
been really fun. Thank
to our
you.
audience, thank you so much for joining. And we'll see you on Wednesday for the next Compassion Center. Take care.